So now we're going to demonstrate in this video clip some basic examination procedures to help us better understand whether hip flexion is being limited by a pain impairment, a weakness impairment, or a stiffness impairment. So, keeping the patient safe, allowing them to hold on to something, we're going to first look at hip flexion by watching the patient march in place. So, Hannah. Visual analysis shows us that our patient's flexing over 90 degrees on the left side, less than 90 degrees on the right side. Okay, now I'll have you stop. At this point in the examination, you can just chat with the patient. Patients often know what's wrong with their joints. In other words, it was clear to me that you couldn't lift your right thigh up so much. Okay, did it feel weak to you? Was that difficult for you to do? If the patient says that they feel weak, that's your indicator to right away just test the involved muscle. So I'd like you to flex that right hip as far as you can. Let's test the strength of your hip flexors. Okay, keep it simple. Nice distal attachment point. Hold against me now. Okay, if we're easily able to push that down, we might come to the conclusion that it's a weakness impairment, limiting our patient's ability to fully flex the hip. On the other hand, if that muscle tested out good and strong, flex as far as you can for me again. Okay, we can easily come along the side and see if it's pain inside the hip joint, okay, limiting full hip flexion by delivering an overpressure. I'm going to lift up a little bit. So we give a little additional passive movement at the end of her available active motion, and if this bothers her in the hip area, then we ask our clarifying questions in terms of intensity, location, and character of that discomfort. If, on the other hand, the patient tells us that I can't lift my thigh any further because it just feels stiff and tight to me, okay? Patients are usually a very good barometer of whether or not they have a stiff joint. So lift as far as you can again, and let's just simply test the end feel, okay? So now you relax that in my hand. I'm going to drop the thigh just a little and do multiple repetitions into hip flexion. If I feel a firm, early end feel, this movement could be limited by shortening of some aspect, likely the posterior aspect of the hip joint capsule.